There's probably no procedure that makes as big a difference with as little amount of surgery as an upper eyelid lift or blepharoplasty. Both the analysis of the upper lids is simple. You're really just talking about extra skin of the eyelid or potentially a little droopiness of the brow that contributes to the extra skin. You need to know which is providing that extra skin and treat them individually. But an upper lid blepharoplasty is a 45-minute operation that's just doing the true nip and tuck of the skin and is very simple and associated with an easy recovery. The lower lid, on the other hand, is much more complicated. The anatomy is different. Sometimes, again, it's just extra skin, but oftentimes there's fat components to the lower lid that need to be addressed. And how you address those fat components is vital. I like to take fat out when it needs it in a very conservative fashion, but not go through any muscle. So the supports to the lower lid are there, and you don't have to change the shape of the eye. I think that's very important. And aesthetically, where the lower lid ends and the cheek or face begins is a little arbitrary. So sometimes instead of taking the hills of the eyelid down, we'll fill the cheek or fill the groove at the junction between the cheek and the eyelid. It is very rare today for me to do a lower lid procedure and not try and blend that with the cheek and add fat, for instance, into the cheek. Therefore, it's a blending procedure. And to just think of the eyelid alone and not think about the face is a little bit naive. It leads to a separation of how one's eyes look relative to their face. And that's not the goal of facial or eyelid rejuvenation. The so-called tired eye oftentimes is associated either with a bag or a groove, and that groove is the junction between the eyelid and the cheek. And therefore, we need to blend that. So the typical lower lid patient has either a pinch of skin, maybe some fat removal, a little bit of laser to improve the quality of the crepiness of the skin, and then using some fat to blend the junction between the eyelid and the cheek to make it more harmonious and look more natural.